Thank you all for coming. How about you start?
Okay.
Handsome?
Wow. Not sure I can live up to that part, but I'm happy to go ahead to say a little bit about, let me say a few things about cancer and fill in a few blanks that were alluded to but not really covered in detail in the documentary. The documentary isn't a movie. It really is a very accurate description of the approaches that have evolved in terms of treating cancer. But if we look behind the scenes, there were some very important components to the approach that I'd like to expand on. One is that every inch of the progress that has been made was not the contributions of an individual, but rather what you're looking at are really team approaches. And there were many folks who contributed to every advance that has been made. And most of the progress that has been made has been through multidisciplinary approaches, partnerships between scientists, physician investigators, and patients. And I think that's very key. And when you look at a cancer center, that is precisely what happens. You're not looking simply at individuals dedicated to diagnosing and treating cancer. You're not simply looking at individuals who are working in the laboratory to try to uncover the causes of cancer and trying to identify the various approaches you can treat particular tumors with, but you're looking at real partnerships, and that's where the progress comes. The other is that in terms of understanding cancer, it's not simply trying to understand a particular dimension of the disease or a particular modality for detection, but it's really trying to focus on the entire continuum to try to understand prevention. And that's something that really wasn't covered. There's an awful lot that one can do to try to decrease your risk of cancer. Then early detection is so darn critical. And again, this is something that we can all do to try to minimize the risk of cancer, or if in fact one encounters cancer, the earlier that one can detect it, the better a chance of being able to get beyond it. The treatments are no longer the way they were at one time, where you really attacked the disease with a sledgehammer, but you heard a little bit about how you try to understand that patient's particular disease and you try to counter exactly where the problem has gone wrong and try to set it right. And then recovery is equivalently important, so one can really get beyond the disease and grow from the experience with a quality of life. And this is all put together in a cancer center, and that's the way one really approaches the problem. And I guess I'd like to end my sort of overview by saying that the major advances we're now beginning to make in the future that we see ahead of us is that a cancer diagnosis is not simply a life-threatening warning, but rather cancer is now becoming a treatable disease. And when we look ahead, we're going to be living with a treatable disease, the same way that you treat cardiac disease, the same way that you treat diabetes. And I think this is something that is incredibly promising and something that we really can look forward to with confidence.
I agree.
You're getting a second opinion.
So I'm a 10-year survivor of cancer. I was diagnosed when I was 29 of a late-stage cervical cancer, which most of us know to be like one of the number one preventable cancers for women with the Pap test. This is the first time I've seen this. I'm hoping in the other 5 that there's some more time put on preventative measures, as it's really, I guess, the new style of life that I have now, post a lot of surgeries and a lot of treatment, and it's something you have to stay after all the time. I had the fortune to have my treatment up at UVM, the cancer center there, which is excellent, and I still go every year. It's sort of a follow-up partnership of life kind of thing. So with my treatment and diagnosis, which was a complete surprise for me, or I guess it is for a lot of people, but I spend my time now trying to ignore cancer and to do everything to prevent cancer. So I started a foundation, a nonprofit that helps provide free screenings for women and for cervical cancer, as well as we've combined with breast cancer, and we also I got the idea, if I can just get them in the door to a doctor's, we'll do everything. So it's a full wellness exam, heart healthy. Mostly because what happens is we're not getting screened, we're not seeing doctors, we're not doing our basic care, which we now know we can do to really help prevent. And as I just learned, if the reality is cancer is in us, it's just a fact, it just needs to be turned on, whether it's genetic, environmental, or chemical. I don't know if that's environmental or whatever, but there's things we can do to prevent that, right? So the reason we don't prevent them often is a way of means or social, financial situations. And here in Vermont, not up in Chittenden County, but definitely in the more rural, outstretching parts of Vermont, it's hard to get to. And I just felt a huge injustice about that piece. And though I was in Burlington and I was getting screened and my cancer was found so late stage, I didn't have the education now that we know that HPV is one of the viruses that causes this disease. And fortunately, there's a vaccine and it can help prevent it. It can also prevent a few different strains of cancer. And I'm a firm believer in it, and people should have the option to do it and at least not have the boundaries so they have choices to get it. It's your decision to do what you need to do, but to not be able to get the medicine you need or want by choice kept hitting me while I was in treatment, thinking that's just not fair. And so I've spent the last 10 years creating free screening days and working with groups that already exist, right? The American Cancer Society, the Ladies First program, federal programs, Planned Parenthood, the Department of Health, immunization program, anything that already exists, the CDC Cancer Registry. I am no way do I need to recreate the wheel. Things are happening, but it seems that sometimes under a nonprofit, private umbrella, people are willing to work together and not have the same ego, and I can get a lot more done with the same partners instead of having one sort of vying for the spotlight. And I've seen a lot more screenings happen, which is my goal. I don't really care about the other stuff. Numbers are really, numbers count, getting everybody in the door, and the results really exciting. It's been, seeing people in town when I walk my dog, be like, I know you. I'm like, why do you know me? I saw you. You don't really want to talk about it. It's a private moment. We don't ever document our screening days, so it's usually a like an eye connection, and I'm not everyone all the time, and so someone really remembering me and personally feeling okay to say they were there. But you usually do after you've had a good test, or even when you found something out ahead of time and we were able to help you. You know, you're even happier to maybe say when you see me walking my dog, like, thanks a lot. And, you know, that's great. Because that's what I needed, and I might need it again. You know, statistics kind of go that way after so much treatment. Sometimes things happen, so that's sort of my story. I missed your introduction because obviously I needed a little mini break, but obviously we'll be here for questions, but that's my statement.
Well, I feel like I'm up here with the experts, and the piece that resonated for me was the scientist who said that the research is a field of manic depression or whatever. Because I work with the lawmakers, so I feel like I'm kind of in that same place. And for me, it's really bringing the message, right? Advocacy is really great in Montpelier because, as a lot of you probably know, we have access to our lawmakers. But that means that everybody else has access to them as well. And they're pulled in a lot of different directions. And so, you know, especially when it comes to money, what I really try to emphasize is that prevention piece, by paying it forward, you're not only saving healthcare dollars, you're saving lives. And in order for that story to really be told, you need the human story. And all of those lawmakers have that same connection to cancer. You know, we have a program going on right now called the 1 Degree from Cancer, and this is it's a federal project that we're working on. But it's this idea that all of us are connected to cancer, and so those lawmakers know intimately those same stories, but how do we get them to then take that step of action? And it takes human beings to tell their own story. It takes that emotional pull. I mean, when I was watching the movie, I was crying and I was thinking, like, oh my God, you know, April 17th, 2012, that's my daughter's birthday, was April 17th, so she was 7 at that time, you know, and you can't help but really have that emotional tie. But when I'm trying to get a lawmaker's attention, the stories, or the human stories, are really what connects them. And when they go to vote on what I've asked them to vote on, that's what comes back to them. It's not me saying, like, 590 people will die from lung cancer this year in Vermont. It's the story, it's the face, it's you know, really that emotional connection, and that's all that we have, because the other people that go to the lawmakers come with dollars, they come with influence, they come with, you know, maybe it's just a bigger story, and so the ego gets attached to it. All that we have is the voice, all that we have is the story, and so that's what I try to represent when I go into Montpelier, or if I go into Congress. And I feel really lucky and honored and frustrated a lot of the time, but it's what I do.
So I'll tell you an interesting story that really reflects on the success of the types of dialogue that you have with legislators. And it was 2 years ago, and it was 4 days before Christmas. And we received a phone call from one of the senior members of the House. And he wanted to know, would we be willing to spend a couple of minutes and tell him about how the Cancer Center actually operates. And we said, sure. And in fact, at the time, it was Kim Lubers and I were the only two people who were there. This was very, very late in the afternoon. He came and stayed for 3.5 hours.
Wow.
And genuinely, and the questions that he was asking us were the questions that we realized we were too close to the problem to be going ahead and thinking about. So that really, to me, means several things. Number one, the feedback that we receive is extremely important. And secondly, there's a direct indication of the fact that there are legislators who are not simply made aware of the problems, but really want to go ahead and to get a second or third opinion and direct information. It works.
Yeah.
And I'd agree. I mean, I've had the same experience with what's become my advocacy work. I mean, it didn't, I didn't think about that was going to be the case, but ending up down in Montpelier several times, helping fight to get insurance to cover Pap tests, to get insurance to cover the HPV vaccine, to be wellness exams to just be considered standard care. And a lot of it would be just a random someone calling, a legislator or their wife, because they're busy, saying we kind of need to, I'm here to get the story on what do you think about this and why, and you've been making a lot of noise about this.
Yeah.
What's your take, or how does it affect you? Because I'm like, and my response would be like, this is how it affects me, and that's how it will affect you. I mean, there's so much money in me just to save my life, right? Like it's always tough for me to watch these films. I by choice don't, unless I need to. Maybe I'm a little manic depressive too. You need to break yourself to just feel that pain again, because we glaze over it. I mean, I don't want to go back there, but I need to retouch that place because it's easy to leave behind. And if I do that, I just get lazy, and I don't want to get lazy. So Lifetime, Hallmark, Ken Burns, to just tap into that place, and it kind of re-stimulates action for me. And also there's the greater action, right? There's the medical action, which I can be a patient, which was helpful to some degree. But I'm a voice of a survivor, and so I believe that. And you're a cure medical doctor, right? And you're an advocate and legislative master. Somebody has to know how to get through all that.
Yeah.
Right? So.
Well, one thing that struck me, and I feel like people should definitely start weighing in here and asking any questions or just having a discussion, but the thing that struck me was how passionate and just how they just kept on plowing through and going. I mean, that's
the doctors.
Just commitment was just incredible. And so that kind of, watching something like that makes me feel more committed, I guess. And, I get calls from people asking for financial assistance quite often because they think that we can give that, and it's rough. I think that that's a piece of the cancer story in Vermont, is that the financial piece, whether it is prevention, whether people are not getting their screenings because they don't think they can afford it, or whether just the whole getting any sort of cancer diagnosis is expensive for the rest of your life, and how it's just a reality. I think I'm looking at Teresa because
you choose to stay away from that. There's so many women who've come to my screenings and have they actually know that they probably, they're hemorrhaging. They really have stuff going on, and they just are mortified. They don't want to do it, and that I don't understand, right? Because I got blindsided. It got told to me before I knew to not know or whatever, to think of that, to even go in that direction. But I also had the education and background to never think that way. So it's easier for me to then just, hold their hand and go in with them and be like, let's just walk you through this. And like, if that's what we know, then like you're gonna live through this. Like almost everybody lives through it now. And there are resources to some degree, more in this state than any place in America. I mean, I've lived in many other states, and I always come back here being like, wow, we have some good programs.
Can you tell us, Dr. Stein, of some of the things that are going on in Vermont, that some research that's going on here that is relevant to what we saw?
Sure. I mean, there's investigation that's taking place, research that's taking place in prevention, and this becomes extremely important because it's clear that diet, it's clear that exercise is going to decrease your risk of cancer. But it goes beyond that. If one encounters cancer, it's going to have a very significant impact on your capability to be able to recover, to be able to tolerate the treatment. And I would say candidly, knowing a number of people who have encountered cancer, they actually grow from the experience, and quality of life is actually improved. And I think that's very key. So that's an area that is often overlooked or minimally considered, but I think it's incredibly important because these are things that we can actually do, for ourselves. In fact, nobody can do it for us but ourselves. With respect to what is happening in the laboratories, without being very granular, I could give you some very specific types of areas that are being investigated. Breast cancer, we are looking for what we call biomarkers, what you could learn from a blood test that is going to give you an indication if you are at risk. If we now have the ability to be able to pull out of a very, very small blood sample, a blood sample that's drawn for a routine type of a test, we can monitor the effectiveness of therapy if one is encountering therapy. And if one is going to be treated for cancer, you heard the apprehension about, my gosh, is it going to recur? When is it going to recur? But we're learning more and more about some of the early warning signs of recurrence. So that's very key. Another area that's being looked at, here's a big black box. So we've talked about ovarian cancer, uterine cancer, and breast cancer, prostate cancer. Mm-hmm. To me, I think a very important problem with respect to prevention is that most women understand that an annual examination is something which is extremely important. And when it comes to men, and I'm speaking because I'm an expert on men, avoidance behavior. I mean, most men are going to go ahead and to deny symptoms and avoid routine examinations. And that's probably one of the reasons that prostate cancer is often detected when it's mid to late stage disease. Is it treatable at that stage? It often is, but the earlier that you can detect a problem, if you're looking at diabetes, you're looking at cardiovascular disease, or you're looking at cancer, you're going to find that the treatment is going to be more effective and the treatment is going to be more tolerable. And in fact, this year we're having the first Men's Health Conference, which is focused specifically on awareness. And I'm looking at a room which is probably about 70% women, and I think it's your responsibility to try to persuade male partners to go ahead and to take advantage of asking the question, in fact, do I have a problem? And if you don't feel you have a problem, get a second opinion that you don't have a problem. So that's very key. And the last thing I mentioned earlier is what is now referred to as precision medicine, and that's really key. We, at one point in time, would treat cancer by killing the cancer cells, and the side effects that a patient encounters is the fact that when you are going to kill the cancer cell, you're going to be killing other cells that are dividing, that need to divide in order to replenish tissue. Now we're beginning to be able to look at what we call genetic markers, what we call epigenetic biomarkers, but these are very precise indications of the actual characteristics of a specific tumor. And so now we can treat in a very targeted way and in a very effective way. But you also heard in the documentary that tumors are incredibly enlightened cells, and they're smarter than the physician, and they're going to go ahead to be able to figure out how to get around the treatment that they're receiving. However, knowing the characteristics of the changes in the tumor, you can then treat it in a way that's going to match the problem that the tumor has gone around. So that was the basis for my comment that cancer is becoming a treatable disease. And that's the way that you treat cardiovascular disease. You modify the blood pressure medication. If you're looking at diabetes, you're going to go ahead, you have 5 or 6 different modalities of treatment. And this is where cancer therapy is heading towards. So that's another area that's being looked at very intensely.
A question, something that was interesting to me that I didn't expect in this documentary was just the role of philanthropy and looking at the March of Dimes and then looking at the Jimmy Fund and how we've now have so many causes that are in competition with each other, and it's created this huge industry of people that marketing and needing to make your cause the most compelling cause, and really funneling energy and resources in one direction when we still don't have universal health care. And it just seems like it was just interesting to me when they moved from a small group of very wealthy people who wanted to make an impact with their abundance to all the dimes, all the all the people out there. And it was just interesting to watch that there, because now we've got this cancer that competes with this cancer, which competes with the lungs, which competes with the heart, which competes with mental illness, which to get our attention and to get our dollar to be
or
worthy
your
of
cat or your dog, because they're starving too.
to be worthy of our philanthropic kind of dollars when we can't get universal access to a screening for healthcare. So I just think that was an interesting element of that.
It is an interesting element, but Vermont is very unique, and yes, there is philanthropy that's raising, where you're looking at fundraising for cardiovascular disease, for cancer, for pulmonary disease, but in Vermont there is a tremendous collaborative team approach. I'll give you one concrete example. The legislative reception that we went to, the Lung Association was there, the American Heart Association was there. We've been putting a lot of effort. Jill has been instrumental in championing the sugar-sweetened beverage tax, dedicated to be able to do really 2 things: raise funds that can be utilized for healthy living, but also to be able to decrease obesity, which is very, very, very much linked to cancer. So who's working on this? We've been working with the American Heart Association, the American Lung Association. This is a seamless collaboration, and that is in terms of addressing the public, in terms of working with legislators. And so it is true, when I was in Massachusetts, there was far less cooperation. But there is recognition that these are not isolated diseases. There are cardiovascular complications of cancer, both the disease and the treatment of the disease. There are pulmonary complications, and it goes the other way as well. So there is not as much competing interests. And I would go as far as saying that a dollar invested in cancer is going to go ahead and have a very direct effect on other areas as well. And healthy living, by the way, is going to go ahead and be beneficial for all of this.
That leads into a question I was going to ask you about your advocacy work.
Yeah.
Who are your opponents?
Who are my opponents?
Yeah, is it, industry, or, I mean, is it corporate interests? Is it other people who, the cigarette industry, or?
Yes, so
Okay.
specifically, we do target different, well, tobacco is a very good example. So we, almost every year, we're asking for a tobacco tax increase because that's something that we know, that if you raise the pack of cigarettes by 10%, you will decrease the consumption. Adults, the rate is about 3 to 4% of adults will stop smoking, and 7% of kids will either quit or not pick it up. So that's a direct correlation, and there's no, as far as I know, there are no benefits from smoking, so we really do go after tobacco, and now we're looking to go after e-cigarettes as well. And so the Grocers Association, which I think that specifically the association is more concerned than the individual grocers, and then the lobbyists for the tobacco companies get very upset, and they really get upset about the e-cigarette piece because they do feel like they're cessation devices, which we really don't prescribe to that thought. And I don't know if anyone saw the last week there was a study that came out that middle school use of e-cigarettes has tripled in the last year, and so we have a problem because cigarettes are no longer cool. I think that people really understand that they aren't cool, but these e-cig things, now those, if you're in middle school and you have your own like e-cig pen that's pink or purple, and then you've got cotton candy flavor, and so
it's
then
like soda pop in a pipe.
it's like this whole generation of kids that are becoming addicted to nicotine again. So it's difficult, even that message of me saying no, they, I mean, I had someone tell me like that I had to agree that they were less harmful than cigarettes, and I said, no, I do not have to agree with that. I do not, and I will not. And so that's a piece that, they appeal to the legislature with the general store is going to go out of business if you raise the tobacco tax. And which has not been what happens, but, the same way that I'll say, the people of Vermont can't, afford this habit, and they can't afford, we need to do this. They say, well, this is the fabric of Vermont that you're attacking. And so there's that emotional component there too. So it's, and everybody, all the lawmakers have a general store in their town, so.
Oh, goodness, I have 2 questions now. So I have one for Gary, and I have one for you, Jill. And the one for Gary is, I was really interested when you brought up the examination difference, that women go to the doctors for the regular exams more than men, and this is, earned them quite a bit of huge benefit when it comes to fighting cancer. But I've also heard through the news and other sources as of late that there's a big push to that we over-examine women, and especially when it comes to breast cancer. And they're looking at now decreasing the amount of time, like how many years you go. So I'm wondering if you think that's a wise move, that women don't need to get mammograms as frequently, and your opinion on that. And for Jill, I really hear you on the, trying to change people's behaviors to get them to smoke less. But I'm wondering if the tobacco tax and sugar taxes, because they are aggressive taxes, if they are really the best way of doing it, because I'm also wondering there's a lot of, with tobacco, there was a huge PR campaigns, changing the packaging and everything else, and I'm wondering if that had more clout, or that would be also a better way of approaching prevention for certain behaviors, and what you see in like maybe the legislative process to create that kind of awareness.
Yeah, I mean, I think it's a combination of a lot of different things, right? I think you need to really look at it from all different angles, and I guess I would push back on the regressive piece, because I would just say that if the tax is high enough, then that price impact is going to drive lower income Vermonters to quit. And if the tobacco tax is what they've been doing over the past few years, last year there was a 13-cent tobacco tax. So they don't even really feel that bump, but it's coming out of their pocket. And my colleague from the Heart Association did a series of interviews with people that had quit. They were people from the 802 Quits. They had volunteered to be interviewed. And there was a man who had bought a boat with the money that he did not spend on cigarettes. So I hear what you're saying, and there's definitely like a piece of me that feels like, wait, I'm trying to fight against cancer and I'm a tax pusher. Like it's an interesting phenomenon, but we have the support of the Vermont Low Income Advocacy Council, because she believes, and we believe, that if you can have it be high enough, that will drive that behavior, and then they will have a healthier life, and they will not be spending so much of their paycheck, such a large percentage of their paycheck on cigarettes. So, but I do think that the tobacco control program is amazing in Vermont. It's very targeted and very efficient. With the tobacco tax revenue and the master settlement dollars, which came from the lawsuit, from the AG's lawsuits, we bring in about $102 million into the state every year, and about 3% of that is spent on tobacco control. So that's really a very lean, mean program, which just got a 10 to 15% haircut from the CDC, from their federal grants, and they're getting cut this year as well. So we're definitely, I feel like it's a combination, and what we really say is that in order to really move the needle on tobacco control, you need this three-legged stool, and that's a high tobacco tax, it's a strong, fully funded tobacco control program, and it's really strong clean indoor air laws. And we have amazing clean indoor air laws in Vermont. We're trying to get e-cigs in there right now. We've got a great program that is not being fully funded, and we have a fairly high tobacco tax, but considering the region, we're 8th in the region, so it could be a little higher.
So you raise a very important question, and that is uncertainty in two areas. One, the definitiveness of tests, screening tests, and secondly, are we looking at excessive treatment? And that, by the way, is reflected in both breast cancer and in prostate cancer. You heard the question, how often should one have a mammogram? And there's another issue that's in parallel with that, and that is there excessive breast surgery, particularly for DCIS? And that is being in fact looked at. With prostate, the same thing. One is the PSA test, the extent to which it is accurate, a real reflection of disease, progressive and advanced stage disease. And secondly, do you treat, do you do a prostatectomy, or do you irradiate, or do you simply observe and watch for progression of the disease? To me, the answer is an annual checkup is absolutely essential, and I don't think that is going to go away under any circumstances. the accuracy of tests, there is investigation both with respect to breast cancer tests as well as for prostate cancer tests and other tumors as well. And they are in fact becoming more effective. But I can't imagine taking the risk of not having an annual exam. I would think that a thoughtful decision in terms of the treatment that one may want to go into pursue, that I think is worth getting a second and potentially a third opinion, but I would never consider avoiding an annual exam. You need, the information is the most valuable thing that you could possibly have.
We talked about prevention and exercise and losing weight, but how does nutrition fit in and vitamins?
Oh, I think we could spend the rest of the evening probably going in and talking about that. It's kind of interesting. With cancer, people wonder if, in fact, there is, in fact, a direct link. Yet, cardiovascular, rehabilitation is a given. If you have bypass surgery, exercise and diet is exactly, what you go ahead and you focus on immediately, following the surgical procedure. We have a program called Steps to Wellness, which is precisely the same approach to how you address lifestyle during treatment and following that. The link between obesity and cancer is very well established. I would put 3 or 4 berries in front of that. That is been established for breast cancer, for prostate cancer, for uterine cancer, for GI cancer, and for brain tumors as well. And there are some mechanistic explanations for that too in terms of the biochemistry. So that's very clear. And what you put in here is in fact going to end up in every cell of your body. I'll tell you an interesting laboratory experiment. If you take cells and you grow them in petri dish in a laboratory, and you change the nutrients that the cells are going to be growing on, you will find very significant differences in how the cells are going, the shape of the cell, the size of the cell, and the properties of the cell. And you're a collection of cells that function in a very integrated way. So what you eat has a very direct effect. Certainly, it's understandable with respect to cardiovascular disease in terms of lipids in the diet, carbohydrate diets. The effect on diabetes and cancer is precisely the same way. It's the cell's metabolism. It's the fuel. It's a source of fuel that you use. The effective fuel, at home, if you burn pine or you burn hardwood, look at what you find, in terms of your heating system and the residue that's there. That's a very good analogy in terms of what's happening in terms of your body.
There were 2 related struggles in the film that were striking to me. And one was where the family of Olivia was trying to decide whether to participate in the clinical trial. And the other was the testimony given by one of the researchers, where he went to his boss and said, "I don't think I can do this anymore." The whole sense of that you're experimenting on people. And I think that's just interesting, and especially in the early years, which we saw on the show, the early years of research, how the scientists must have felt about that. Things are a little bit different now, and there's probably a lot that technology has helped with. There's probably a lot of research that we can do without, before we do the trials on humans. But people are asked every day whether they will participate in clinical trials. And really those people are, we should lift them up as heroes because they are helping advance the research.
I agree completely. I don't think there's anything more I could add to it. I think you said it very articulately.
But it is a tough decision though. And they never told us, at least in this excerpt, what the family decided about Olivia, whether they were going for the trial or not.
Yeah. I think that's such an awesome point that, you know, in order for the research to move forward, that it's not just the doctors taking the risk, you know, it's really that patient that's willing to do it.
And there's another side to it as well, and that's that a number of these studies are what they call double-blind studies, where you may be making a decision between therapy or a placebo.
Mm-hmm.
I mean, as a patient, I mean, I didn't need to do a trial. I had a lot of surgeries beforehand for tumor extraction or whatever they want to call it, which were really hard on my body. So I ended up having a lot more struggles in that aspect, which delayed all of my treatments by months because I couldn't actually heal to actually start a treatment. And the idea is you can't really start chemotherapy, which will kill all your cells from, you know, building while your tissue's trying to, you know, close up. But I still felt like aware of, you have to sign contracts when you decide to go in and do these things. Like when I chose to get treatment, I had to sign a contract that I was giving away every rights for my reproductive health, that I knew that I was going to have a hysterectomy, and that therefore this is exactly what this meant. And it's incredibly shocking and hurtful and painful and stunning to be like, oh, there's like a paper contract of an agreement that yes, I'm going to do this, because halfway through you don't really want to be doing it, and you do continue. You're like, you know, you want to live, so you do it, but you still feel like a bit of a guinea pig, even though you're just. And there's this compassion piece, like nurses are like the best part. Like you guys are great, but the nurses are where it's at. And they're the ones who, you know, are holding you and hugging you and, you know, pricking you too, to some degree, but, trying to make you feel the best with what they know that they know. And maybe we'll know more in a few days, but this is what we know for now. And you just sort of blind faith, be like, okay. And then some days you're like, maybe we should get another nurse in here. I'm not connecting with you at the moment. I don't believe you. I need to believe somebody. But that kind of, you find someone else who has that, like, that spirit, right? Like that drive, that belief, and you see it in them. And once you find someone to focus on and who believes, it's like so much easier to take in like all those nutrients. Like there is a spiritual piece that I don't think that ever can really be quantified, but yeah, nutrition I think is super vital, and doing all the treatment completely, like, you know, finish your antibiotics and being well beforehand. I mean, I happened to be very healthy beforehand, but I still ended up with a, you know, stage 3 cancer. But the point of finding people and community around you that believed in you really like pulls you through to another level of finishing, you know, and then you finish and then you're at like 0, and then you have to recover. So I hope they have a movie on that part. Like that's the big cushion.
Why
The
don't we
build.
take one more question?
I just was curious if anybody'd seen the other.
I've seen parts of
Episodes.
it.
There's
And in
5.
fact, Farber has a big conflict about the question you raised. He didn't want to treat any more children. You know, so I wonder if maybe we can get it from the library, because it was on several nights in succession. But
Yes.
We only
Yeah.
have this DVD, but you can watch it on
Online.
PBS.
Yeah, take
Yeah.
a look at the website, PBS's website, and they're rerunning it.
Online.
There's gonna be times on television as well.
Oh, great.
Yeah, so you'll
And
be
they
able
have
to see
2
that.
channels. They have the regular one that we know.
There's a Vermont PBS, and then they have a national PBS channel.
Right, so you can access it to
Yeah.
two different channels.
I've actually watched the entire series, and I would strongly recommend it because a lot of the issues that we've been discussing as a group are actually covered in a very, very understandable and in a very balanced manner.
Oh, great.
Thank you.
Well, I want to thank everyone for coming here. Thank you very much to our panelists for coming. It's such an important issue.